This presentation is about peptic ulcer disease. Peptic ulcer disease occurs when sores develop on the gastric and duodenal linings. These occur when an insufficiency of mucus in the stomach allows for stomach acid to damage the lining of the stomach. These ulcers can lead to bleeding from broken blood vessels in the stomach and small intestine, obstruction of the stomach, as well as peritonitis. Most frequently, infection with Helicobacter pylori or chronic use of nonsteroidal anti-inflammatory drugs create conditions in the stomach and upper small intestine suitable for the formation of peptic ulcers. Ulcers can be very uncomfortable and cause symptoms such as stomach pain, bloating, heartburn, feelings of fullness, and nausea. These symptoms can be worsened through consumption of spicy foods and stress. Peptic ulcers occur in 6 to 15% of people, with 10% of people reporting having experienced symptoms of peptic ulcers in the past. There are a number of risk factors that contribute to the development of peptic ulcers when a person is using NSAID drugs. These include being aged over 70, being a female, taking 2 or more NSAIDs at once, taking NSAIDs long term, having previously had a peptic ulcer, having chronic illnesses, taking corticosteroids, as well as drinking and smoking. Peptic ulcers are also caused by Helicobacter pylori infections, and 30 to 40% of people will get one of these infections at some point. Helicobacter pylori can be spread through unclean food and water, unsanitary eating utensils, and contact with bodily fluids, especially saliva. Quality of life for people living with peptic ulcer disease is improved when symptoms are treated early and subsequently prevented. Because of this, it is very important that peptic ulcers are effectively diagnosed. Some methods used for diagnosing peptic ulcer disease include taking a detailed history of NSAID use, checking for bloating and other symptoms of peptic ulcers, auscultating gastrointestinal sounds, palpating and percussing for pain in the abdomen, testing the blood for Helicobacter pylori, performing a urea breath test that checks for higher levels of carbon dioxide indicating presence of Helicobacter pylori, testing the stool for Helicobacter pylori, performing endoscopy and biopsy, taking an upper GI series by X-ray, and performing a CT scan, which can be done with dyes or contrasts. Goals of pharmacotherapy for treatment of peptic ulcer disease include providing immediate relief from symptoms, promoting healing of the ulcer, and preventing future recurrence. Treatment for peptic ulcers is highly dependent on the cause of the ulcer itself. There are 3 main causes of peptic ulcers, which include NSAID-induced, Helicobacter pylori, also called H. pylori-induced, and NSAID-induced with H. pylori infection. The drug classes used are protein pump inhibitors, histamine receptor blockers, protectants, antacid, antibiotics, and bismuth subsalicylates. Protein pump inhibitors act by reducing stomach acid secretion by binding irreversibly to hydrogen ions, potassium ions, and ATPase. There are used short-term agents that typically used for about 4 weeks. A benefit to this class of drugs is that benefits continue for about 3 to 5 days after the treatment has been stopped. One kind of proton pump inhibitor is omeprazole or Prilosec. It binds with the enzyme hydrogen potassium adenosine triphosphate to decrease the secretion of acid in the stomach. It is effective for 2 hours after administration and is effective for up to 72 hours. It can be used for a 4 to 8 week therapy of peptic ulcers, and prescription as well as over-the-counter are available. On this slide, you'll see details about the dosage, adverse effects, and onset of omeprazole. On this slide, you'll see contraindications and interactions, as well as nursing considerations for omeprazole. On this slide, we have ranitidine. It is a H2 receptor antagonist that decreases acid production by blocking H2 receptors in the stomach. It's used for peptic ulcer disease, and drug maintenance may need to continue past the normal 4 to 8 weeks healing time. Longer regimens help to prevent recurrence. This should be administered once a day, preferably at night right before bed. Onset is 30 to 60 minutes, with its peak at 2 to 3 hours, a duration of 6 to 12 hours. It's not overly metabolized in the body, but goes through the renal and hepatic organs. It is excreted by the urine and the stool. On this slide, you'll also see the dosage for ranitidine and its adverse effects. To continue, this slide lists contraindications, drug interactions, as well as nursing considerations for ranitidine. Antacids used to be highly used to treat peptic ulcers, but research has supported that they do not have any positive benefits to treating ulcers because they do not promote healing of the ulcer, nor do they help prevent H. pylori infections. They are fast-acting and act within 10 to 15 minutes and only last for about 2 hours. Adverse effects include constipation and aggravate kidney stones. Calcium carbonate antacids induce hypercalcemia, headache, urinary frequency, anorexia, nausea, fatigue, and permanent renal damage. On this slide, we have aluminum hydroxide, which is an antacid. It raises the pH of the stomach contents to neutralize the stomach acid. It helps to strengthen mucous membrane lining in the gastrointestinal tract and improves esophageal sphincter tone. It can be used by itself or in combination with other antacids. For peptic ulcer disease, aluminum hydroxide is used in combination with other anti-ulcer drugs for alleviating heartburn. On this slide, you'll also see metabolism, dosage, and adverse effects for aluminum hydroxide. On this slide, you will see contraindications, interactions, and nursing considerations for aluminum hydroxide. Protectants produce a gel-like thick substance that coats the ulcer, protects it from further erosion, and promotes healing. An example of a protectant is sucralfate. It is only prescribed peptic ulcer drug in this class. Adverse effects are rare because so little of the drug is absorbed into the GI tract. A disadvantage of this drug is that it has to be taken 4 times a day. Bismuth subsalicylate coats peptic ulcers and protects them from stomach acid. They have the ability to kill H. pylori, but it is not typically used to kill the infection by itself. It can be used concurrently with antibiotic to help accomplish this. A common bismuth subsalicylate is Pepto-Bismol. Sucralfate is a GI protectant. The mechanism of action is that it contains a sucrose and aluminum hydroxide. The drug creates a thick coat that forms a barrier around the ulcer. This prevents the ulcer from irritation and allows it to heal. It is used for peptic ulcers and to prevent the erosion and to allow healing to occur. On this slide, you'll also see the dosage, metabolism, and adverse effects for sucralfate. On this slide, you'll see the contraindications, interactions, and nursing considerations for sucralfate. On this slide, we have bismuth subsalicylate. It is an absorbent, and it coats and protects the stomach lining by binding and blocking bacteria and viral pathogens from secreting, growing, and causing inflammation. It is used for those with diarrhea to absorb excess fluids. It helps to return gastrointestinal flora back to its original state. Onset is 1 hour with an unknown peak and unknown duration. On this slide, you will also see dosage, metabolism, and adverse effects. On this slide, you'll see interactions, contraindications, and nursing considerations for bismuth subsalicylate. There are also specific regimens that can be used to treat H. pylori-induced peptic ulcer disease. There are 3 types: triple therapy, quadruple therapy, and sequential therapy. Triple therapy is prescribed for 7 to 14 days and includes a PPI, clarithromycin, and metronidazole, or amoxicillin. Quadruple therapy is a 14-day regimen and includes a PPI, bismuth subsalicylate, tetracycline, and metronidazole. Sequential therapy is a 10-day regimen. This regimen is a combination of PPI and amoxicillin that is to be taken for 5 days, followed by another 5 days of PPI, clarithromycin, or tinidazole. As you can see, drug therapy to treat H. pylori infections are much more aggressive and complex than treating an NSAID-induced peptic ulcer. Tetracycline is a protein synthesis inhibitor. It is a bacteriostatic drug that inhibits protein synthesis by binding to the ribosomal subunits of the bacteria. The drug may change the cytoplasmic membrane as well. It is an antibiotic that is effective against a range of gram-positive and gram-negative microorganisms. It is effective against the bacteria H. pylori, which has been known to cause peptic ulcer disease. Can be given via intramuscular injection, topical cream, or orally, depending on the bacteria that it is working on. Onset of tetracycline is 1 to 2 hours. The peak is 2 to 4 hours, and the duration is 12 hours. The half-life is 6 to 11 hours. On this slide, you'll also see dosage, metabolism, and adverse effects of tetracycline. On this slide, you'll see contraindications, interactions, and nursing considerations for tetracycline. Omeprazole is a protein pump inhibitor. It works by blocking the formation of acid in the stomach by inhibiting the proton pump, which is where hydrochloric acid is made. This drug is used for almost any condition where stomach acid is causing a problem or tissue injury. Omeprazole is prescribed for 4 to 8 weeks for therapy of peptic ulcers. It should be taken before meals, as it is most effective if it is taken right before eating. The patient is prescribed tablets or capsules. They should not crush open or chew them. If the patient is using the oral suspension, they should empty the packet into a small cup containing 2 tablespoons of water, stir, and drink immediately. Then refill the cup with water and drink. Other foods and/or liquids should not be used to dissolve the packet. If a dose is missed in the morning, you can take it if you remember in the afternoon. Otherwise, resume the following day as normal and do not double up on doses. Side effects of this drug are minor and can include headache, nausea, diarrhea, rash, and abdominal pain. Patients should contact their doctor if they experience any worsening symptoms, fever, chills, severe headache, or severe diarrhea. There is also an increased risk for osteoporosis-related fractures of the hip, wrist, or spine. Omeprazole should be avoided if pregnant or breastfeeding. Simultaneous use with diazepam, phenytoin, and central nervous system depressants can cause an increase of blood levels of these drugs. Simultaneous use with warfarin may increase the likelihood of bleeding. Alcohol is contraindicated as it can aggravate the stomach mucosa and decrease the effectiveness of omeprazole. This drug should be stored in a tight container away from children, and lastly, omeprazole should be taken for the full prescribed length of time, even if symptoms have cleared up. That concludes our presentation on peptic ulcer disease. Thank you for your attention.